So as a doctor in Canada, I hear this all the time. There are no doctors in Canada. And although that's not completely true and it's not completely false, I've noticed a few things in my practice among people who are both newcomers and those that have lived here all their life. I've noticed that even when people manage to get a doctor, many of them don't even know how to keep one. So let me give you a typical scenario. And I see this happen all the time in the clinic. So let me just call this person Amaka. So Amaka is a newcomer. She has come to Canada and she was even lucky and she was able to find a family doctor within her first few months, which is typically rare. And as usual, life got busy. She was fairly healthy and she just focused on settling in, making things work, taking care of her family, which most of us would do. And it's not terrible, right? But one thing is that she did not follow up with her doctor after that first visit. And of course, after 3 years, she started having some kind of health issues. At first, it was just something mild, nothing urgent. And then when she finally decided to reconnect with the doctor, she called the clinic and they told her that you've been removed from the patient panel. And this is because she hasn't been an active patient. And then for somebody who doesn't have a regular provider, she had to bounce around a few walk-in clinics. And although those are great, right? And they are good and they can offer some good care. But the lack of that continuity can mean a lot. And it might mean repeating a bunch of tests, telling your stories all over again. Your test is being delayed, referrals are falling off the track. And there's nobody actually tracking your health journey. And those are the limitations with the walk-in clinic. Unfortunately, this is not a unique story because I've seen it happen time and time again. Many immigrants and even locals alike, when they come, it's easy for them to fall through the cracks, which is a big challenge. And it's not because they didn't care about their health, but because they were not sure how the system works. So in today's episode, I'm here to give you some real strategies on how not only to find a doctor, but how to keep one and just to make the most of the healthcare system, even when it feels the way it feels. So hey there, my fellow transplants. Welcome back to the Immigrant Health and Wellness Tips with Dr. Amma. This is the podcast where we talk about all things health, all things wellness, and real immigrant life abroad. So many of you may or may have not heard the phrase, there are no doctors in Canada. So although it's not like there's literally zero doctors, but sometimes it actually feels like that, even for me as a practitioner. So let me explain what I mean. People will be asking the question, so where are the doctors? Fair question, right? As of 2023, according to Canadian Institution for Health Information, Canada had 2.4 doctors per 1,000 people, which is considerably below the OECD average, which is around 3.5. And the OECD is like the Organization for Economic Cooperation and Development. And it doesn't even end there. And we've noticed that even in some communities, especially rural communities or immigrant dense neighborhoods, it's not unusual for you to have to wait weeks or even months for a simple appointment. Family doctors are retiring, clinics are full, and 30% of Canadians don't even have a regular family doctor. And I'm talking about over 11 million people. And yet, fortunately, Canada is still often ranked among the best healthcare systems in the world. So what's really going on? Why are we getting these numbers? The short answer is manpower. There's no manpower. And for the long answer, here are a few things that we'll see. Number one, medical school bottlenecks. We've seen that Canada trains fewer doctors per capita than many developed countries. The spots are limited. As for internationally trained doctors, that's another problem. They are often stuck in bureaucracy limbo. So while we continue to fight that and hope that things improve, that is one big issue that we're struggling with. The next one is the retirement wave. The average Canadian doctor is over 50, and many of them are retiring faster than new ones are coming in. So there's that empty room to fill. The next thing there is burnout. And then bureaucracy. Doctors are spending more time. I can't tell you the number of time that we're spending on doing things like paperwork than even actual patient care. Imagine wanting to help people. You come to the clinic to help people. Out of 30 patients you see in the clinic that day, at least 10 is asking you for one kind of paperwork or the other, and it's just you that can fill that paperwork. And you're spending about 60% of your time filling forms. Kai, it's very annoying. It's very annoying. And then there's that urban-rural divide. Most doctors live in the bigger cities, and then the rural communities are left with the smaller end of the stick. Now, I'm talking about these things, and somebody will be wondering, why does all of these issues matter, especially for somebody who is new here? But remember this, when you're new in a place like Canada, like I've been saying, one of the biggest mistakes that you can make is waiting too long. to register for like healthcare or to find a doctor. Although I get it all, many people are focused more on other important things like housing, like school, job hunting, trying to pay bills. These are all important, but I have to still remind you that health is not one of those places that you need to procrastinate, and for clear reasons. You can't get a family doctor overnight. And in some places, some provinces, it might take months, or you might even have to go to another town. It has happened multiple times. As for walk-in clinics, they are great, right, for quick things, but that continuity might not be there. And if you have a chronic issue like high blood pressure or diabetes, it's not ideal. It's not advocated for. And then for people who don't have a family doctor, you tend to miss out on certain things. Like I always say, see your family doctor as your safety net or like a quarterback. And with them, they can coordinate all these referrals. So if you don't have one, you can easily miss out on referrals, preventive care, and even some added mental health support. If you haven't done it already, or if you're still getting around to it, first things first is, I always say, register for your health card if you haven't done it. Each province has its own health plan, but the basic process is for you to either apply online or go to a registry and apply. I'll attach a few provincial links in the episode show notes for you to check out depending on where you're located. And then for the big question, how do I find a doctor? And it breaks my heart to say this, but finding a doctor in Canada right now is like finding a unicorn. Like finding a doctor that is actually accepting patients, is like finding a needle in a haystack. But still, I'll still attach a few provincial specific search tools. Like if you're in Alberta, like the albertafindadoctor.ca, I'll attach that in the episode show notes for you to also check out. Other ways that you can find a doctor, you can ask your pharmacist. Most times, most offices might know new pop-up clinics and the ones that are actually accepting patients. You can even call clinics directly. So look up clinic directories and phone them directly. Ask to be put on their wait list. Things happen. People get unalive, or people move out of province, people move out of town, people switch all the time. So being on the wait list is at least something to do. Then I always believe in the word of mouth based on recommendations or from like local groups, from friends and like family. I've seen a few patients that have been recommended to me by my existing patients, and depending on my state or my schedule at that time, I might be able to see them. So that's also something that you can do. You can tell a few friends and family to discuss to their doctor and see if they're willing to take you on. Especially that works better in like a family unit. And then for those that actually, you now have a doctor, keep them. And that's the whole idea of this podcast today. Keep your doctors. Finding a doctor is not like Tinder. Unfortunately, you can't just swipe left on your doctor because they didn't give you that antibiotics to treat your sore throat, or they didn't put in that referral when you wanted it. So if you have those kind of concerns, that's where communication comes in. Always talk to them and tell them how you feel about things, right? And if there is a clear divide or a clear rift in that connection or communication after you have discussed, then you can consider looking elsewhere. And just as a pro tip, if you don't see your family doctor regularly, they can actually discharge you from their panel. They can easily kick you out because there are lots of people waiting to get in. And once that happens, actually getting back in, it's very difficult. So try to show up for your annual checkups, book your follow-up meetings when you have that. And if you have ongoing concerns, like I said, discuss openly and respectfully. And that brings me to the other thing that I'll say, be respectful. And not just of your doctor, but the entire team, the receptionist at the front desk, the administrative team. Try to be respectful and build the relationship, because that continuity actually saves lives, right? That way you're not falling through the cracks. And for those who have landed in a province and you're not covered, if you're in that health coverage limbo, for example, like in BC, where you have to wait for like 3 months before it kicks in, consider private insurance. And there are lots of options in Canada. Some of them include like Blue Cross, Manulife, Sun Life, Green Shield, a bunch of them. You can look them up and they will give you enough coverage for like emergency care, prescriptions, dental, vision, mental health, a few things. So just shop around and see what works for you and your family, because even something as simple as a basic plan is way better than having none at all, especially when life decides to throw you a surprise party. So you're prepared. So once again, I want to use this opportunity to reach out to people. Let's talk. Okay, your story actually matters to me and to us in this growing community. Today, I've shared some of these tips. I really want to hear back from you. What's your healthcare story as a newcomer? Did you struggle to find a doctor? Have you been discharged from a clinic before? How did you overcome that? And did you discover like a health hack for immigrants in your city? I'll be happy to hear from you, right? So let's share these stories, not to complain. I'm not here for complaining. If you're going to complain to me, please provide a solution. We have this conversation so that we can build strength. Because yes, I know that the system might be flawed in certain ways, but we are actually more resourceful than that. We're not just the average humans. We're more resourceful. We are thriving where we're planted. We're growing. So send me a DM, an email, voice note, whatever. Just reach out to me at Dr. Amma Speaks. Your story might be featured in a future episode. And if you've got some positive suggestions for ways that we can improve the systems while we're still working on the back end, I'll be all ears and happy to hear those recommendations. And before you go, hit that follow button, share this episode with that your newcomer friend or somebody who's been here for a while and needs this information. Let's continue to spread the knowledge and the awareness. Once again, this is Dr. Amma and I'm signing out, but not before saying stay well, stay hopeful. Until next time, bye-bye.